Welcome to another COVID-19 update. I am Stacey Carmichael and I'm joined by Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's a pleasure having you again on the program.
Well, thank you for having me once again on this program.
Good. Now, Minister Anthony, COVID-19, it's still around and, there are many concerns and persons are asking, in terms of those persons who have tested positive for the disease, but they don't show any symptoms, how is the ministry monitoring those persons to ensure that they self-isolate?
COVID-19, as you rightly said, is still around, and it's going to be around for a while. And I think people would have to adopt until we get a vaccine. As you know, the scientific community globally is working on a vaccine, but that might not be ready until late this year, maybe first quarter, second quarter next year. And there's still a lot of doubts about whether or not, how this vaccine would work, how many doses would be available, whether you'll have 1 dose, 2 doses, or so forth. So until then, we still have to take the precautions. And when we test people, a lot of people are asymptomatic, and we have to ensure that those persons also follow the guidelines, and that is they have to self-isolate or they can go into an institutional isolation. The reason why asymptomatic persons might be even a greater risk to other people, because some asymptomatic persons if they don't test, they don't know they have it. And these persons are generally regarded as the super spreaders because they have no signs, no symptoms, no nothing, but they are infected and they can spread the virus. So that is one of the reasons why we all have to be cautious, and that is one of the reasons why we have to keep taking those preventative measures, like wearing a mask and washing our hands and keeping our distance. So it's very, very important. But the short answer to your question is really those asymptomatic persons, once they've tested, and if they're positive, then we isolate.
The National COVID-19 Task Force, how has the task force been functioning and what are some of the plans going forward?
The task force, we have different levels. So at the policy level, we have been looking and making various policies regarding COVID-19 in Guyana. That policy level, we normally would oversee what is the trends of the epidemic, where are the hotspots, what is happening, what we need to do. And also the policy level, we review the COVID orders and to decide based on the epidemiological data, we advise the government what position to take. So the policy level, we have been doing that type of work. And then you have other levels, if you like. So you have the health response, which really operates out of the Health Emergency Operations Center that is under the Ministry of Health. And through that health response, we have our hospitals across this country. We have been equipping them. We have been making sure they have the medication so that we can respond appropriately to persons who would come to use our services. Also, we have the National Public Health Reference Lab, through which we are doing the PCR testing. We have trained a lot of people to do the swabbing and so forth. So all of this is part of that health response. And another component of the health response also has to do with surveillance. So knowing where those who have tested positive, where they are, how they've been isolated, getting people to call them up and check on them to see whether or not they're getting symptoms, they're improving, what is happening with them. Or persons who have been exposed and are in quarantine, to ensure that those persons that we checked on those persons as well. So we have basically what it is testing, contact tracing, and if you test positive, to be able to offer you treatment, especially if you're having things like respiratory distress and so forth, and you're required to be in the hospital. So we are able to provide that treatment for you. So that's the health response. The other response has to do with the socioeconomic response. And you know, there are various businesses that have been ailing because they haven't been able to work as effectively in this COVID environment as they previously were doing. And the government, through the budget, would have some stimulus package for those entities. And once these measures are passed, you know, small businesses and other businesses would be able to benefit from these measures. In addition to that, you would have heard the president announcing that there would be a $25,000 cash grant to families or household, and that would be rolling out soon. So that is another benefit that people would experience through this socioeconomic committee that we have. So there are multiple ways in which we are responding to the pandemic. We're trying to create a comprehensive package of things that we do, or a comprehensive menu that we're offering. So it's not just a medical response, but also these other responses that can help people through this pandemic. And of course, we have been working with private sector partners, other stakeholders, to be able to reach the most vulnerable amongst us. And we'll continue to do that. So through the task force that we have, this is how we have been responding. And of course, at the policy level, because of the nature of the task force itself, we have a number of international agencies, and they have been able to link us globally. So we are part of that global environment. Through these mechanisms, we are able to access scarce items that if we didn't have these linkages, it would have been difficult to procure. So we have been working both with the global community and the local community to respond more appropriately to COVID-19 in Guyana.
And Minister Anthony, as it relates to the enforcement aspect of the measures, how is that coming along, you know, in terms of reducing gatherings of crowds and so forth, ensuring people maintain certain distances and stuff like that?
I think that's still a weak area for us, because while we continue to emphasize enforcement, it is still challenging. We depend a lot on the police and other such agencies. So that has been a challenge for us. We know that there are places where people gather, and we need to see more action in those areas. Seawall gatherings, people are still doing them. People going out to shops, cook shops, going to, you know, to these places, and they're taking off their masks, they're drinking while waiting on their food and things like that. These are all places where you can easily get infected and you know, contract the virus. So we have to do more in educating people, and we can amplify this education if each one of us who know the right things to do, if we tell our friends and family and other people around us, if we are near an environment where we see these things are happening, we should find a way of communicating these things to those persons who are the violators. So that, you know, if we all take this form of responsibility, I think it would help us to get that message over and get people to start practicing the right thing. And we have to work together, because this, as I keep saying, is not one agency, it's not the government's problem alone. It is all of us got to be involved. It's a societal problem. And if we are going to be successful, then we have to approach this thing in like a team. If each member of the team do their part and play well, then the team is going to be successful. But if you have persons who, just don't care, then it's going to be harder to win anything. And in this case, we want to win this battle against COVID-19. So if all of us work together, play well, do the right things, and I keep emphasizing the 3 W's: watch your step, wash your hands, wear a mask. If we do these 3 simple things and keep practicing it, I think we all will be safer.
Thank you very much, Dr. Anthony, and also thank you very much to the listeners and viewers. This has been COVID-19 Update. Thank you.